ago, a small group of volunteers got out of a van in Tandana, Ecuador, with a cardboard box full of medicines to see if anybody would show up for the health care they offered. Several months earlier in Kansongo, Mali, I was visited by some members of the village association who explained to me that they wanted to restore a well, create a grain bank, and have tools for their anti-erosion work. During those encounters, I never could have imagined that 10 years later, Tandana would be flourishing with strong relationships and multiple programs in dozens of communities in Ecuador and Mali. Recently, our 21st healthcare volunteer vacation arrived in Larcacunga, and this time with a pharmacy, a lab, a vision screening station, and a dental team, in addition to the healthcare providers. Patients quickly fill the outdoor waiting area. Meanwhile, in Mali, 6 wells have been restored and a new one dug. 2 grain banks now offer millet at affordable prices year-round. And we're working with an association of 15 villages to provide tools for the anti-erosion work that they want to do. This growth has emerged from Tandana's unique personal orientation, creating other people in relationship. Many organizations take a systemic view of the world, identifying problems that they describe through terms like mortality rates and caloric intake and gross national product. Taking this distant view gives us the illusion of being able to understand and control the world we live in. It gives us the illusion of not having to respond to the simple moral demands of encountering another person face to face. But this illusion obscures our shared humanity. Tandana is built on a different perspective, a first-person orientation, greeting other people in dialogue. And that stance gives to us and to our friends full human agency, the opportunity to act in meaningful ways and to participate in live encounters between different people. It lets us see opportunities for collaborating to make dreams come true instead of problems that require technical intervention. This orientation leads to a spirit of sharing based on simple human values like respect and responsibility. An attitude of respect calls us to honor the ability of the community members we partner with to define their own priorities and initiate their own projects. It builds confidence among them, inviting them to invest in that collaboration. Patients in Ecuador are moved by the respect of healthcare providers who take the time to really listen to them. Elders in Mali are often surprised that Tandana actually follows the priorities that the village has set. A commitment to responsibility leads us to follow through on our promises, to offer ongoing friendship, and to expect the same from our local partners. This value brings about completed, successful, and sustainable projects, instead of ones that break down after a year or are left half-finished for decades. Community leaders experience their own effectiveness in achieving their goals with Tandana complementing what they already have. Responsibility to our patients has led us to develop a patient follow-up program whereby we help the patients access the additional care that they need through the public health system. In some cases, villagers in Mali have been led on so often by NGOs that on their first project with Tandana, they don't even start working until they see Tandana's contribution arrive. After the first project, they know that they can depend on our word. And these core values have led us to concrete improvement in people's lives, but also to friendship, mutual understanding, and learning. Students from Ecuador have graduated from universities, and they're working in their professions like accounting, law, and medicine. Farmers in Mali are harvesting pomegranates and custard apples and other fruits that they have never seen before. Community members in Ecuador are caring for over 3,500 native trees that they planted to protect their watersheds. Women in Mali are managing communal stocks of cotton that are making their cloth businesses successful. While hosting volunteers, communities in both Ecuador and Mali have found that their guests' interest in their culture renews their own enthusiasm for maintaining and strengthening it. And volunteers from the United States have returned home from trips to these communities, inspired to return for annual visits to see their new friends, or to befriend refugees in their own towns, to devote more time to volunteer work, and to reach out across social barriers. As Fabian Pinsag from Wenala explained in the video, through these experiences, we understand each other, we communicate. And I think that is a great achievement for human beings, to know that even though we are from different countries, we are one. Thank you so much for making this work possible. It's because of each of your contributions that Tandana can bring people together as friends and let so many good things emerge from that encounter. I invite you to continue the journey with us as we enter our second decade. Our friends in Mali and Ecuador have many more exciting dreams for their communities, and you can help us follow through as responsible partners in the relationships that we build. And you can help us show respect to people who have too often been ignored in the design of solutions to their supposed problems. I invite you also to carry Tandana's spirit of respect and responsibility with you everywhere you go. We need it now more than ever, in our nation, in our world, and in the many communities where each of us interacts with others.